Hello, my name is Dr. Equitasio Coro, and I am the chair of the National MCH Epidemiology Awards Committee. And I would like to start by acknowledging the land of the Muskie and the Cree that I currently reside. Over the next hour, we will be honoring the recipients of the 2021 National MCH Awards. On behalf of the Coalition for Excellence in MCH Epidemiology Awards Committee members, I wanted to reiterate how important we all felt about honoring our MCH colleagues. Although we cannot gather in person to share in the joys and excitements of the awardees, we hope they still feel how much their contributions have meant and will continue to mean among the MCH community. So now to the awards. So the first award to be given out today is Effective Practice Award at the local or community level. And this will be presented by Dr. Theresa Mendez. Dr. Mendez.
Good morning and good afternoon. Thank you for this opportunity to share about a very amazing leader in our field. This leader is Theresa Seagraves. She's currently the Franklin County of Ohio Public Health Department Assistant Health Commissioner and Director of Health Systems and Planning. And one of her nominators described her as a, quote, quiet powerhouse. And prior to her position in Franklin County, she was instrumental in a number of initiatives within the area of maternal child health. That's included assisting CityMatCH develop the Ohio Institute for Equity and Birth Outcomes in 2013. She was instrumental in pointing out the state's high infant mortality rates, including Black infant mortality. This led to the state's development of their first infant mortality reduction plan, and also convincing state legislators to declare infant mortality a statewide crisis. This was all during a time of political will and leadership that refused to acknowledge racism as a contributor to adverse health and saw social determinants as, quote, smoke and mirrors. So this was the context in which she was really leading this work. More recently, she's been engaged in her current role with Franklin County in initiating a health equity lens and efforts internally. That's through training, hiring, creating an equity agenda for all county agencies, and instituting health and all policies related to health equity as well across the organization. She's also been instrumental in leading discussions about state-sanctioned violence in the face of the killings of George Floyd and Breonna Taylor, as well as leading efforts around addressing racial disparities in COVID outcomes. Her efforts have also been related to declaring racism as a public health crisis. This was one of the first local health departments to declare racism as a public health crisis in Ohio, which led to many others across the state looking for leadership and support in doing that work in their municipalities. She also has been instrumental in centering the community and community voices in the work of the local health department. This is something that hadn't been done, and leadership really looked to her to ensure that this was being implemented throughout the work. And this led to the community health assessment and the community health improvement plans, really shifting the paradigm and the narrative around centering community voice and experience. Part of this work has led to the convening of a new health equity advisory council in which she also serves as a leadership role. And these are just a few of her many accomplishments. And I'd like to just end with a quote by one of her nominators, which says, "She is absolutely incredible, hardworking, honest, has a strong sense of integrity, a firm belief that data should form the foundation of our intervention efforts, and an incredible commitment to the inclusion of those most adversely affected in the evaluation and decision-making processes regarding interventions. She deserves to be acknowledged for her many years of dedication and leadership, and we acknowledge her today." Congratulations, Ms. Theresa Seagraves.
Thank you so much for those kind words. I have to say that I am so humbled and honored to be receiving this award. While I've been involved in maternal child health work in some form or fashion for over 30 years, I have to admit that the last 15 have been the most rewarding for me. Those 15 years include my time at the Ohio Department of Health, where my previous Title V director, Karen Hughes, served as a MCH mentor for me, and I was able to learn so much from her. And then, of course, my current time working at the local level here at Franklin County Public Health has just been rewarding. And what's been so rewarding about this time is the opportunity I've had to combine the areas that I'm most passionate about: diversity, equity, and inclusion with data. Utilizing data via the skills of epidemiologists have provided me with the outlet to be the voice at the table, pointing out the disparities and the community conditions that have historically kept poor and marginalized populations from being their best and their healthiest selves. During this pandemic, I think while the pandemic has been horrible, it's also been the perfect storm for the field of epidemiology, and because it's being recognized and valued for the expertise that they bring to the table. And I want to say a special thank you to the team of epidemiologists that I work with on a day-to-day basis. They do incredible work, and to all the epidemiologists out there for the work that they do. Finally, I just want to thank the Coalition for Excellence in MCH Epidemiology for recognizing me and for awarding me with this special recognition. Again, I feel humbled and honored. And I also want to thank Dr. Arthur James for nominating me. If you know Dr. James, you know that he is a man of excellence and a very, very committed person to maternal child health. So for him to recognize me and to feel that I'm worthy of this award, that is an honor in itself to me. So with that, I just say thank you for this award. Thank you, everyone, for being in attendance today. I hope you all have a great day and have a wonderful time enjoying the rest of the conference.
Thank you so much. We'll move on to our next award to be presented, and this is Effective Practice at the state level, which will be presented by Dr. Joya Carrera-Perry.
It is with great honor that I am able to give the award to the Massachusetts Health Department for the RESPIT team, recognized for being the Coalition for Excellence in MCH Epidemiology as the 2021 recipient of Effective Practices at the state territory level. Since 2018, Susan Manning and her colleagues have really been working hard to ensure that racial equity was seen in a data roadmap. It's a tool towards eliminating structural racism by collecting guiding questions and tools and resources to assist programs from the ground up. This is a revolutionary idea because guess what? We don't normally listen to folks when we're having data who are actually impacted by the data. So thank you to our colleagues in Massachusetts for providing us with a data roadmap and a way to visualize data that ensures that we all have justice and joy. Congratulations.
Thank you, Dr. Carrera-Perry, and good morning or good afternoon, everyone. My name is Susan Manning, and I am the CDC Maternal and Child Health Epidemiology Program assignee to the Massachusetts Department of Public Health. On behalf of the RESPIT team, which stands for Racial Equity Strategic Pathway Implementation Team, the developers of the Massachusetts Racial Equity Data Roadmap, I would like to thank the Coalition for Excellence in MCH Epidemiology for this award. We would also like to thank leadership at the Mass Department of Health who have supported us in this work, including Commissioners Monica Burrell and Margaret Cook, and our Title V directors, including Craig Andrade, Allison Melman, and our current director, Elaine Fitzgerald Lewis, who nominated us for this award. This work, which is part of the department's racial equity movement, began as a Lean Six Sigma quality improvement project conducted by a team of epidemiologists in the DPH Bureau of Family Health and Nutrition to explicitly use data to dismantle racism in DPH programs. The project expanded into the development of the Racial Equity Data Roadmap, a resource with broad applicability that can be used by other jurisdictions, disciplines, and organizations to guide how they use data to inform their own efforts to eliminate structural racism. December 6th marked the one-year anniversary of posting the roadmap to the mass.gov website. During this first year, the webpage has been visited almost 6,000 times, and the roadmap has been downloaded well over 3,000 times. We are especially excited that the roadmap is being used on the national stage in an upcoming CDC ASTO Learning Collaborative focused on supporting states to use data for racial equity work. We are eager to learn from the experiences of other states using the roadmap, and we will incorporate lessons learned from their experiences to inform future revisions of the roadmap. We recognize that in order to eliminate racial inequities and health outcomes, we need to work across systems and sectors to dismantle the systems of oppression and disadvantage that have caused and perpetuated inequities. Focusing on data is a natural place to start as organizations identify where to prioritize their work to address racial equity. RESPIT members have been invited to share information and support the implementation of the roadmap across all bureaus within the Massachusetts Department of Public Health. We have also been invited by partners external to DPH in the health, education, child welfare, and nutrition sectors to provide presentations and workshops on the roadmap. We hope that the roadmap can be an entryway to initiating conversations about using data to promote racial equity in other jurisdictions as well. I didn't begin with a land acknowledgement, but I would like to conclude with one. We acknowledge that the land where our team lives, works, and learns in Boston is the original homelands of the Massachusetts tribal nations. We acknowledge the painful history of genocide and forced removal from this territory, and we honor and respect the many diverse Indigenous peoples still connected to this land. We also acknowledge that we have more work to do to improve the reporting of race and ethnicity in our data. Massachusetts received a grade of B- on the Data Genocide of American Indians and Alaska Natives in COVID-19 Data Report Card, which was highlighted by Abigail Echo Hawk in her keynote presentation to kick off this conference. We commit to doing more to understand the disproportionate impact of COVID-19 and other health outcomes on people of color in Massachusetts, specifically American Indians and Alaska Natives. And we will include guidance and resources on how to combat the erasure of American Indian and Alaska Native people in public health data in future revisions of the Racial Equity Data Roadmap. Once again, we are honored to have our work recognized with this award, and we extend our sincere gratitude to the committee for selecting us. Thank you.
Congratulations again, RESPIT team. Our next award is that's to be presented is the effective practice at the national level, and this will be given by Ms. Kelly Tater.
I'm Kelly Teeter and a member of the CityMatCH board. I'm here to present the award for effective practice at the national level, and this year the award goes to Childbirth Connection. Childbirth Connection, located at the National Partnership for Women and Families, was established in 2005, and it is the organizational successor to the Maternity Center Association, founded in 1918 to provide comprehensive maternity education and care to underserved women through New York City neighborhoods. Childbirth Connection has been at the forefront of key issues in maternity care and public health for all these decades. It's not hyperbolic to suggest the focus by Childbirth Connection on consumer perspectives and the needs of those consumers has reshaped the discussion of maternity care, not only in the United States, but also in a number of countries where their approach has been replicated. To list their accomplishments would take all day, but as the nominator so beautifully noted, their success has been characterized by a number of underlying principles. First, an absolute emphasis on evidence-based practice, consistently drawing on research in order to guide the development of a remarkably diverse set of recommendations, clinical, public health, and policy issues. For example, the trade-offs associated with cesarean versus vaginal births, a dynamic that we include now regularly in our policy, cost, and outcomes conversations. Secondly, a practice of building a collaborative across consumers and professionals to find sensible approaches to the most complex issues, pain management in labor being the best known example. And finally, and the most basic of all, focusing the discussion of maternity care on the people most involved in this experience, the birthing persons. This consumer orientation and their careful, indeed sometimes literal listening to those having the birth experience has grounded the Childbirth Connection in equity, from which place they have been driving change for over 100 years. Please join me in congratulating Childbirth Connection, located at the National Partnership for Women and Families, on receiving this year's award for effective practice at the national level.
Good afternoon, everyone. My name is Maureen Corey, and I was fortunate to be the executive director of Childbirth Connection from 1995 when I joined through 2014 when the program moved over to the National Partnership for Women and Families. I want to thank you for the wonderful introduction and for the kind words about Childbirth Connection. It's truly an honor to be recognized by the Coalition for Excellence in Maternal Child Health Epidemiology. We're very grateful to those that nominated us and to the committee that selected us as recipients. Congratulations to the other recipients as well. As I said, I joined the Maternity Center later to become Childbirth Connection in 1995 at a time when the then 80-year-old organization was going through a major transition from the provision of maternity care in the country's first urban freestanding birth center in New York City, where over 2,000 babies were born over a 20-year period. The board of directors remained committed to focusing on improving maternity care for moms and babies and challenged the staff to develop a new strategic direction for the organization, and we did just that. The board enthusiastically endorsed our plan to launch a long-term national program to promote evidence-based maternity care. We believe that the best evidence should guide policy, practice, education, and research. And together over the next 20 years, Carol Sakala and I implemented the program. One of the best things that ever happened to me in my professional life was meeting Carol. Followed shortly thereafter by meeting Jean DeClercq, who became a valued partner in many aspects of your work. And I'm sure most of you know Jean DeClercq. Carol's and my partnership was magnified through collaboration with literally hundreds of diverse stakeholders, including the board, funders, other staff members, midwives, physicians, nurses, doulas, childbirth educators, advocates, and policymakers. And really, most importantly, women themselves. We believed in the power of using the best evidence to drive maternity care quality improvement and empower women with trustworthy information to make needed decisions or informed decisions about their care. I retired in 2014 after 20 wonderful years of working at Childbirth Connection and look back with gratitude for the opportunity to have worked with Carol and others on behalf of mothers and babies. I continue to follow the field as much as possible and have found that retirement opened the door to new challenges, such as learning to play golf, which is quite a challenge at 70. I'll end with special thanks to Jean DeClercq, our valued colleague, particularly on our Listening to Mothers surveys. And lastly, to the National Partnership for Women and Families for continuing and expanding Childbirth Connection programs and agenda. The program is stronger than ever thanks to the leadership of Carol Sakala and the health equity team at the National Partnership. The challenges ahead are formidable, but I'm very confident in the National Partnership's team's ability to make a positive impact on improving the quality, equity, outcomes, and value of maternity care in women's childbearing experiences. Thank you all for your work on behalf of childbearing women, and happy holidays. Now my colleague Carol Sakala will speak. Thank you.
Thank you, Maureen. Our national long-term program to promote evidence-based maternity care was inspired by the game-changing 1989 book, Effective Care in Pregnancy and Childbirth. This compendium of systematic reviews was proof of concept for the Cochrane collaboration. At the turn of the century, we surveyed leading organizations in the field. Just one response indicated awareness and recognition of the value of this work and the principle of using best evidence to guide our approach to maternal and newborn health. During our 20-year collaboration, Maureen and I aim to bring to light and close gaps between mounting evidence and widespread practice. We did this as clinical epidemiology knowledge brokers, synthesizers, and commissioners for both professional and consumer audiences. We also used other kinds of evidence to examine foundational topics. For example, a commissioned synthesis of more than 1,100 citations clarified current knowledge about the hormonal physiology of childbearing. It detailed safe, effective biological processes that maternity care practice often disrupts and fails to recognize. An update on maternity care and liability found that the burgeoning body of critical legal studies did not support many widely held beliefs about this topic. And our Listening to Mothers surveys systematically gather another crucial type of evidence, the views and experiences of childbearing people themselves. Survey results often reveal gaps between best evidence and what people actually experience, and between what they want and what they get. And I also want to shout out Jean DeClercq, our essential, cherished partner in these surveys and much more. Maureen's and my values, vision, and commitment are closely aligned, and it was my immense good fortune to work within this exceptional partnership for 2 decades. I miss our collaboration since her retirement and appreciate the home we found for this work at the National Partnership for Women and Families. It's been a great privilege to do this work and now to continue it in the context of unprecedented mandate and will to improve our substandard and inequitable outcomes. This recognition was a complete surprise. We're grateful to those of you who worked with us over the years and made good use of our work, and to our nominators, the awards committee, and organizers of this event. This is a great honor. Thank you.
Well, we just want to congratulate again to all of our effective practice awardees. So could you guys in the chat say congratulations or give them some emojis for a second here? Just let's acknowledge them if you don't mind. Thank you, guys. Okay, we'll move on to our next group of awards. Our next award to be presented is for outstanding leadership, which will be presented by Dr. Barbieri. Dr. Barbieri?
Thank you. I am pleased to present the 2021 Award for Outstanding Leadership to my hero, Dr. Audra Meadows. Dr. Meadows is my hero because she is a superb clinician, a resilient advocate for advancing maternal child health through system change and legislative advocacy, and a leader of the highest integrity. Consistently over decades, Dr. Meadows has demonstrated exceptional skills in identifying gaps in equitable care that needed immediate attention. For Dr. Meadows, discovery of her problem requires quick, decisive action to mitigate or eliminate the problem. Whenever she tackled a problem in maternal child health, Dr. Meadows had the vision and skill to always build new viable teams and permanent infrastructure that would be the foundation for advances in the future. A bit of background on Dr. Meadows. She's a daughter of Texas, graduating from Texas A&M University and working in the field of chemical engineering before entering medical school. She received her MD degree from the University of Texas, San Antonio, where she was class president. She completed a residency in obstetrics and gynecology at Brigham and Women's Hospital and Massachusetts General Hospital, And following her residency, she was recruited to be a Commonwealth Fund Health Policy Fellow, receiving her MPH from the Harvard School of Public Health. She was on the faculty at Harvard for 2 decades and recently has moved to Southern California and is on the faculty of University of California, San Diego. As a side note, Dr. Meadows enjoys driving a sporty convertible fast, and Southern California will certainly be more conducive to that hobby than Massachusetts ever will be. Dr. Meadows' contributions to maternal child health are too numerous to enumerate at this presentation, but briefly, she helped to create a Massachusetts preterm birth prevention committee sponsored by the Women's Caucus of the Massachusetts State Legislature. This was a culmination of decades of work identifying specific communities with a very high rate of preterm birth and adverse newborn outcomes. She drafted and was an advocate for House Bill 4818, which passed this year and calls for a special commission of 23 legislators and community members to meet no less than 4 times in locations across the state in communities experiencing the highest rates of maternal and newborn mortality and morbidity. The commission will issue a report to guide the development of further legislation. Dr. Meadows helped create and support legislation to provide state funding to the Mass Perinatal Quality Improvement Network, also known as PINQUIN. And as co-chair of Mass PINQUIN, Dr. Meadows and her colleagues established Massachusetts as an alliance for innovation in maternal health state, established an important maternal health data center in collaboration with the Betsy Lehman Center for Patient Safety that resulted in sharing with hospitals their maternal morbidity data by race and ethnicity. She advanced the Massachusetts Levels of Maternal Care Project with 100% hospital participation and launched the Massachusetts AIM initiative called Our Birth Equity Journey. During her 2 decades at the Brigham and Women's and Harvard, Dr. Meadows was the beating heart of our clinical obstetrics program. She is always optimistic, collaborative, and fun to work with. I'm very pleased to present the 2021 award for outstanding leadership to my hero, Dr. Audra Meadows.
Thank you so much. Thank you for those kind words. I am truly thrilled and honored to be a recipient of the 2021 Outstanding Leadership Award. Having this award be presented to me by national leaders, including my hero, Dr. Barbieri, national leaders in maternal child health, is an added honor given the steadfast commitment to improve the health of all birthing individuals, their children, and families. I would like to acknowledge and thank my mentors and supporters and the PINQUIN team. So to Drs. Job, Dr. Noor, Dr. Robinson, Dr. Barbieri, thank you for your support. Thank you to the women and birthing individuals who have given me the privilege and honor to partner and care for them through my career. To the honorees and previous honorees, congratulations and thank you for your inspiration, your contributions, and dedication to this work. The work itself is a daily honor. The opportunity to give care, to have a front row seat of birth statistics, and importantly, the birth experiences and stories of women, and then to have the opportunity to bring together partners in birth facilities in Massachusetts to drive improvement forward has really been a daily honor. I am most excited about the Massachusetts Birth Equity Journey as we work together to grow interstate partnerships to improve birth equity through quality improvement. And I'm looking forward to future work across the states with that. That said, to my colleagues at the NNPQC, NICHQ, other state PQCs, and the PINQUIN team and the PINQUIN board, we have such a strong village. You bring passion, inspiring exchange of ideas and strategies that have led to so many wins for moms and babies in Massachusetts and across the nation. So today I celebrate you and I look forward to our continued collaborations. Thank you for this award and let's keep working to ensure maternal safety and birth equity. Thank you.
Congratulations again. So we're now moving to our final awards we presented today. And this award is for Advancing Knowledge Award. And Dr. McCormick, you have the floor.
Thank you. It is with the greatest pleasure that I introduce this year's awardee, Rear Admiral retired Dr. Wanda Barfield. And in full disclosure, I have known Wanda since her fellowship training, and I will not rehearse all that time. When you look at the criteria for this award, it says the individual may have done this or may have done that. With Wanda, there are no ors. She's done it all. She has seamlessly incorporated her clinical skills and insights into rigorous empirical research in the factors affecting the health of mothers and newborn, and made major insights into that. This advancement of knowledge, however, is not sufficient for Wanda. She takes this information and conceptualizes strategies to improve the outcomes of mothers and babies. But just thinking about that is not enough for her either. Moving beyond thinking about how to do it, Wanda has fostered numerous strategic initiatives through state associations, new collaborations among providers, and professional associations in setting clinical guidelines. Through it all, she's continued to consider the next generation of MCH epidemiologists, mentoring younger colleagues, as her nomination packet indicates. In sum, Wanda is the complete MCH epidemiologist who has used her skills in a multifaceted public health approach to improve outcomes. For Wanda, it's not just the numbers. I think too many of us know epidemiologists for whom it's an intellectual exercise. It's the beginning of changing things through a passionate commitment to the well-being of mothers and their newborns, especially the most vulnerable populations.
Oh, thank you so much. Dr. McCormick, thank you. I just want to say thanks to the National MCH Epidemiology Awards Committee that selected me for the Greg Alexander Award in advancing public health knowledge through epidemiology and applied research. This is such an honor because Dr. Alexander was a major influence in my early career. I studied Dr. Alexander's work in infant mortality back when I was in medical school, and the principles of his work have carried through my career. I also want to thank Dr. Donna Peterson, who helped to provide this award in her husband's honor. And in addition, there are so many people to thank. Of course, my family, my husband, Joe in particular, who supported me at every opportunity presented. My sons, Trey and John, now young men who embody why this work is so important. And my mentors, so many of you here, and several who have had no relationship to public health and MCH epidemiology, but whose principles of leadership were universal. Thank you. So in my office, I have a plaque with a quote from Dr. Alexander, and it states, "We must continue to build our data capacity and use our data judiciously to expand our understanding, to question our assumptions, and to explore and evaluate new approaches. Nonetheless, we move from data to effective action and change more than maternal child health epidemiology. It really takes leadership." So his message stuck with me, and I'm so thankful that these principles have guided the work of MCH epidemiology and the CityMatCH community. I want to share some examples of how his wisdom has applied to our work in maternal child health in recent years. So first, to continue to build our data capacity, the collaborative work with our colleagues in CDC on infectious and non-infectious disease has allowed us to respond with incredible swiftness to the COVID-19 pandemic, particularly to understand its impact on pregnant and postpartum women and infants, and provide guidance in unprecedented times. To use data judiciously to expand our understanding of the safety and effectiveness of contraceptives in the context of chronic medical conditions. To question our assumptions so that we measure racism instead of race and understand what we need to change to improve quality, measure and improve equity, and reduce morbidity and mortality. To explore and evaluate new approaches using social determinants of health, yet continue to stay true to tried and true approaches to community engagement. And to move data to effective action and change through leadership. And that's your leadership. Lastly, I want to thank every single member of the Division of Reproductive Health, both current and past, for creating a legacy of judicious data use, new questions to old assumptions, exploring of new approaches, and tremendous leadership. And I want to thank the members of the CityMatCH community and the MCH community, all of you here today, because by coming together in this conference, we're really embodying the work of Dr. Alexander in terms of advancing public health knowledge through epidemiology and applied research. And I'm particularly excited about the new generations of leaders who will continue the legacy, not only within DRH, but elsewhere within CDC, in tribal nations, in state and local health departments, academic institutions, and private organizations. And I hope that we'll continue to follow Dr. Alexander's example to bring us even closer to a future with optimal and equitable health for all mothers and children. Thank you.
Congratulations, Dr. Barfield. So I would like for all of our awardees to come on camera, please, so that everybody can thank you and acknowledge your accomplishments yet again. Well, again, on behalf of CityMatCH, the conference, and the coalition, we just want to give a big congratulations again to all of our awardees. Again, can we, and I know we've been saying congratulations, but one more time, let's thank them all in the chat or using the emojis, just congratulate them all again for their great work and the ways they've contributed to MCH. Okay, congratulations, everybody. Our hope is that next year we'll be able to see you all in person and celebrate you all for your amazing work and accomplishments. So thank you all again for joining us for another year of the National Awards. I just want to give one last update before we adjourn. Again, you know, there are a lot of wonderful sessions that are in the conference, whether it's a life skill builder or on-demand session. Again, we encourage everybody to attend. And we want to also really encourage you all to attend our closing plenary for tomorrow, entitled Radical Self-Care, which is something we all can relate to, and Community Love, Mindfulness, and the Foundation of Racial Justice by Wanda McGee. So I hope everybody will be able to attend that. So thank you all again, and the next session will start at the top of the hour, so enjoy your free time, and congratulations again to the 2021 awardees. Thanks, bye everybody.